The lens of therapeutic communication through a technique called motivational interviewing. So if you've noticed our book, almost all the books in nursing for therapeutic communication, they don't really give you any legs to stand on. It's just a lot of different pieces of information, but it doesn't really give us like a method. It doesn't really give us a framework to apply those things. And oftentimes, without a framework, it's like we have no way to work with the knowledge, so we just simply won't use it. And this is why you'll sometimes see nurses take that like very super customer service approach when we get into patient care. You know, that like, hi, my name is Brandon. I'm just letting you know today that I'm your nurse, and if you need anything, the call light's there. See you later. Um, Probably not the best way to start communicating with a client, right? We're going to talk about why that's important. And then we're going to go through some of the techniques for motivational interviewing. But this is all going to be founded on this theory of change. Like, it's going to be very important for us to be able to recognize what stage of change is my client in, because that's going to determine what type of verbal interventions do I do. So we're taking that first part of our upside down pyramid and we're really defining it today. We're really getting into multiple ways to use it. I will say this right now, that therapeutic communication is the most difficult skill that you'll learn. It's difficult because it requires real-time thinking and real-time response. It's not like we can plan to do an intervention, we do it, we wait for the results, hours later, and then we still sit there and plan and evaluate. No. This has to happen usually within 5 seconds when we're having this communication. So it's very difficult, but we're going to get there. With practice and time, we will get there to where we will be that professional. So we'll kind of learn about the theory of change and how do we use that as a nurse to help that apply to our clients. We'll be watching quite a few different videos. It'll be a good practice for us to kind of listen to what the client is saying, for us to determine where do we go next from this? What type of techniques do we learn to go where we need to be for this client's goals? It's all still going to come around the client. What goal do we have for a client? Why are you even talking to the client? Are you just going there because you have an assessment to complete? That's not going to be the best scenario for every single case that we're going to be interacting with our clients for. So we're going to talk about going in with a purpose, going in with a goal, and helping the client reach that goal. Other than that, that's kind of what the basis for today is going to be about. So I think before we could even get into the techniques, get into the theory of all of that, it's going to be very important for us to at least set ourselves up with being a professional. So this all comes down to the introduction. That first time you meet that client, how are you letting them perceive you? Very, very important. You kind of hear those things like first impression is everything. Well, it kind of does. Most of the time, people will make up their mind about you within the first second of them even just looking at you. This is why we're so important and so big on like your uniform, because unconsciously within that first second, I like you or I don't like you. I know it's kind of sad. A lot of, prejudice, unconscious prejudice, a lot of unconscious biases start off that way. But a good way for us to correct that immediately is to start this professional introduction. Very, very important. This is going to be in 5 pieces. So if you want to follow along in the part of your therapeutic communication worksheet packet for that professional introduction, that's also on there too. 5 pieces though. Number 1, just tell us your name. That's kind of important, right? Number 2, we're going to do something that's called an affirmation. The client doesn't have to speak to you. The client doesn't have to let you care for them. We want to make sure that the client still feels like they're somewhat in control. This is immediately starting to help build trust with this relationship. So thank you for talking to me. Your name, thank you for talking to me. Next is going to come for 3, and these can be mixed up interchangeably. It's okay. Your role, where are you from, and why are you talking to me? 3, 4, 5. So your name, thank you. Your role, where are you from? Thank you for talking to me. So, hi, my name is Brandon. Thank you for talking to me today. I'm from Riverside City College. I'm a registered nursing student. I'm in my mental health course right now, and we're learning how to provide mental wellness. I'm wondering how you're doing today or how your experience has been here so far. Um, Kind of doing all that together. The way I'm saying everything is very structured. The way I'm even mentioning mental health, I'm trying to avoid that stigma that people have. I don't want to say things like, I'm learning how to provide care for mentally ill patients. I'm here for mental illness. I usually say mental wellness. I'm here to provide mental wellness care or mental wellness services is kind of important. So, and that's kind of like where a book stops. Use therapeutic communication to kind of work through the different phases of the nurse patient relationship and you'll be good. It doesn't, it's like it gives us multiple pieces to a car, but it doesn't tell us how to put the pieces together, let alone even drive the car. That's the problem that I have with our textbook. It's good to learn the basic definitions. It's good to learn just little bits and pieces of that. But at this level of nursing, we're going to take it to the next therapeutic level. The techniques that we're talking about today, um, a very small number of healthcare providers know this. So licensed marriage family therapists, psychiatrists, medical doctors, very even smaller amount of nurses know these techniques. So why is that? Well, it was previously thought that nurses don't have the capacity to do this, which is just like total baloney, hogwash, malarkey, right? Poppycock. What do you mean we don't have the capacity? We're human beings too. Like we can learn this advanced skill. Um, and this is kind of what my whole doctorate research was about is using these skills and how can nurses use these skills to benefit their clients. Hey, guess what? We spend the most time with our clients on that floor, right? Wouldn't it be great if we had these advanced techniques to be able to take their care to the next level? That's what this is all about. So as far as analyzing test questions, uh, you want to follow just two basic rules. Two basic rules will get you about 90% of the way there. This won't really help you in clinical practice as much, but at least it'll help you understand the way these test questions are kind of set up. Uh, Number one, never ask why. Usually about 90 to 95% of the time, when you see a why question, we're just going to cross it out. That's not correct. Although I'll teach you the time that you can use why and how to make it a very powerful why question. But other than that, let's stay away from that. It's a very challenging statement. It makes the patient feel defensive, and it sometimes will destroy trust that you have. So never ask why. Number two, focus on the client's feelings and emotions. So always choose the options that's focusing on the client's feelings and or emotions. You're going to see some type of responses that many healthcare professionals fall into, called the expert trap, where the client comes up to you and says, I don't really feel good today. I'm not really feeling it. The expert trap would be something like, oh, well, you're not feeling good because you have depression and your neurotransmitters are most likely in a decreased state of being. So that's why you don't feel good. That's not that's not helping me. Thank you, Mr. or Mrs. Robot, for telling me that, but I don't care about that. I'm just letting you know I don't feel good. I'm not so sure I want to take my medications. Well, medications are going to be really good for you. It helps to decrease the severity of your illness. Thank you, Mr. and Mrs. Robot. I'm still telling you, I feel a certain way. Focus on the client's feelings and emotions first. Then we're going to talk about a structure of what we do next after that. If you largely follow those two rules, you'll get the simple therapeutic communications correct all the time, like for sure. Especially when you go into nursing 22, you're going to get them right. It's just any question that NCLEX throws at you, no problem, you're going to get them right. If we're still feeling stuck, we're stuck in the water in the conversation, I don't know where to go, we're going to learn these next skills, OARS, OARS. I'm going to introduce you to them right now. We're just going to mention what they are, and then we're going to come back and talk about them. So open-ended questions, affirmations, reflections, and summaries. Those are our four fundamental skills for motivational interviewing. Open-ended questions, affirmations, reflections, and summaries, OARS. This is going to be our basic algorithm to follow when we're trying to analyze test questions. It'll be somewhat okay when we're in real time working with a client, but it's much, much more than this. This is kind of like where our book stops. It just like gives us this and that's all. So we need to take it to the next level.